Hi, everyone. Good morning. Good afternoon. Thank you so much for joining us for a deeply concerning and very urgent and unfortunately quite timely conversation on the gutting of Roe v. Wade, which is not only a crisis for women and for families in our country, it is also a public health crisis. And I'm so thankful for the three amazing women that we have in conversation today, all three of whom really kind of fall into the cliche of needing no introduction, but we'll briefly introduce them. We will hear first from Terry McGovern, who in full disclosure is a good friend and a mentor, and someone I am so profoundly grateful for her just indefatigableness in this fight and in so many others. She is the chair of the Halpern Department of of Population and Family Health at the Mailman School of Public Health at Columbia University. And she will be joined by the equally remarkable Cecile Richards, the co-founder of Supermajority, and kind of previously the equally indefatigable head of Planned Parenthood. And then we'll be joined by the kind of equally brilliant and tireless Dazan Dixon Diallo, who is the president and founder of Sister Love, and also a tireless champion of women's rights, of human rights, and of ensuring that we are always mindful of the ways in which women's rights and human rights are always public health issues. So could not imagine a more kind of prestigious group than these three women to talk about a real existential crisis that we are confronting in this moment across the United States. And so, Terry, I hope that you could start us off by framing the conversation in like, why are we talking here in early May? Why is it so important that we are focused on these questions now? What do you worry could happen in June when the Supreme Court decides or announces its decision on Dobbs v. Jackson? And just kind of not so much what are the stakes, because hopefully we're all aware of what the stakes are, but kind of what in your crystal ball of pain and experience do you see happening in June and then from June forward?
First of all, thank you, Chelsea. And of course, all those adjectives you use for us should be used for you. I am thrilled to be on this panel with four people who are so incredibly committed and will not look away from this issue. I am actually going to go into a little more detail because I keep having the experience of people saying to me, "Oh, wow, I have no idea what's going on," or "So glad you're working on this." And actually, we need everybody to pay attention to what is happening right now, because we're pretty sure, if you listen to the Supreme Court discussion at the Dobbs case, that they will gut or overturn Roe v. Wade. Nobody has a crystal ball, but that is happening for sure. So I want to run through a bit of the details of what will happen. So 22 states have laws or constitutional amendments on the books that will severely restrict or end abortion. And of course, many of them have been unenforceable because of Roe, and they will be enforceable once Roe goes. Post-Roe bans currently blocked by court order would also go into effect. 13 states have trigger bans, laws that will be implemented when Roe falls. Several states have laws to severely restrict abortions past 6 or 8 weeks that are also blocked by court order. So in the past month, Kentucky, Florida, Arizona all passed laws to ban abortion after 15 weeks. West Virginia looking like it'll follow. Oklahoma took this to the extreme, passing a near total abortion ban that punishes providers with up to 10 years in prison, as well as a Texas-style ban that allows individuals to sue people for helping someone obtain an abortion. Every lawyer and many other people are going to be listening for what this decision says. Many states have provisions to go into special session based on what the decision says. So we're going to have a lot of fast moving parts. So medication abortion, which again, many people are saying to me who are not following this closely, isn't this a potential solution to mitigate the impact? Of course, states have already made it more difficult to access medication abortion. I am kind of going through the horrible details here, but of course there is activism, points of light, incredible things happening, which the other speakers will speak to, but I'm just laying out specifically what some of the things that will happen. So 19 states already require a physician to be physically present to administer medication abortion, eliminating this option of telehealth. Texas and Indiana both ban abortion pills after 7 and 10 weeks of pregnancy. 8 states are trying to ban abortion pills altogether. So you see, it's not a perfect solution. There are some ways that people are working to ensure access, which we'll talk about. So just to say, the current and future abortion bans will have devastating health outcomes. Researchers have estimated that a total ban could increase pregnancy-related deaths by 21% overall, 33% for Black women, as childbirth is way more dangerous than legal abortion in the US. In many states overlooking to overturn Roe, maternal mortality rates are already higher than the national average. In the US, which of course has the highest rate of maternal mortality of any nation. Just quickly, Black women in Mississippi almost 3 times more likely to die of pregnancy-related causes than white women. This is not even introducing unsafe abortion into the equation. The system allows for high rates of unintended pregnancy, and those rates are highest among those below the poverty level. You remember all of the restrictions we've lived through to Title X in the Trump administration. Our research in many states shows the ongoing attacks have had a big impact, and that is the context that we're talking about. So we are also seeing criminalization for pregnant people and the people who help them. Sadly, a lot of these bounty hunting concepts come from the fugitive slave laws, which people have written about. 18 states have criminal laws on the books that open the door for prosecution of pregnant people and their providers. They'll be enforceable when Roe falls. Of course, there's a recent move in state law to redefine terms like personhood, child, to include fetus, unborn child. This could lead to additional abortion-related prosecutions under homicide, feticide, assault, child abuse. Feticide laws are already being used to prosecute pregnant people who are accused of self-abortion. Obviously, this does not just put the pregnant person at risk. Abortion providers, people who work at clinics, partners, and friends could be subject to criminal liability. This will not affect everyone equally. As we know, Black Americans are currently incarcerated in state prisons at 5 times the rate of white Americans. Black women are already more likely to be arrested, reported to authorities, and subjected to felony charges related to their pregnancy and pregnancy outcomes than white women. All of this will get worse. There's a lot of legal questions, right? You have to actually have a case to prosecute somebody. So there's lots of questions about HIPAA protections. Will the federal HIPAA protections provide some coverage here? There's questions about federal law versus state law in the realm of medication abortion. The list of kind of legal issues to watch here is enormous, including, can we actually prosecute people who are helping people cross state lines? So there's a lot of people working to figure out the best possible strategies to avoid criminalization in as many cases as possible. I'll just finish by showing you what we're doing in the department to actually just remind people that this is a public health issue. We wrote a letter urging SCOTUS to uphold Roe v. Wade and kind of enumerating the public health reasons for that. We have already, I think, 10 or so of the deans of the most prominent schools of public health. We're looking to publish this in the Washington Post as an ad. We're trying to raise funds to do that, to actually just show that there is massive public health resistance to this. Because somehow it keeps not being described as a public health issue, which of course it completely is. So maybe just go to the link, JP. So we have a deadline for signatures, May 6th, and there's a link at the top. So we're looking for anybody who works in healthcare to please sign. I want to say again that while I just said a whole bunch of stuff that's quite grim, there are so many amazing people working on this, but we need everybody in this immediate time frame. And I just want to ask people, no matter how tired you are, lift your head up and pay attention here, because we need to fight back. Now's the moment. So.
Well, and Terry, I think what you outlined is all of the kind of pieces of legislation that are kind of in the wings or in the waiting room, kind of whatever the right metaphors are, are also really important for people to understand. It's not as if kind of there will be a race to kind of operationalize these horrors. I mean, that will happen in some states, but in other states, there will just be kind of this unlock of really kind of dangerous behaviors, vigilante behaviors, everything that we know is contra to, to human rights and to, a woman's autonomy and to public health. And I think that's a really important point that if nothing else is kind of, hopefully something that people joining us today will leave understanding the magnitude of what will come quickly. And we know that though, that's not all we have to worry about. So Dazon, I wonder if we could turn to you next and you could share, rooted in your experience with, HIV/AIDS and also your experience in trying to help expand, rights and the ability to exercise those rights, for women across our country, what else you're concerned about and kind of what else you really want people to understand. So, Terry gave us a quick, painful, expansive look at all of the legal threats to kind of human rights and public health that could well be coming quite soon into force. Those though are not the only threats that we see in this kind of broader effort to gut Roe v. Wade from a cultural and a social perspective. I wonder if you could, kind of flesh that out a bit for us too. Oh, Dazon, you're on mute.
Great, because I was cussing like nobody's business while Terry's talking. I'm glad I was on. So not at you, Terry, about all of the stuff. So, and I guess I'm going to compound this a bit. So thank you so much, Chelsea. And thanks, Terry, for giving us that overlay, because I think that this next level in this conversation truly is about how it's actually being implemented in ways that we're not expecting yet. The other night I had the privilege of sitting with and interviewing Billie Avery, and the founder of the Black Women's Health Imperative, formerly the National Black Women's Health Project, and just luminaire in all things Black women's health, especially sexual and reproductive health rights and justice. And one of the things I asked her, because I think this is a frontier that most people are not paying attention to. I think this is something that is, it's an insidious movement that's afoot and that is poised to do even more direct damage, not only to the individuals, pregnant people, pregnant women who are seeking abortion services and finding themselves in these fake clinics, but also their families and by extension, our communities. And what I asked her was, well, what are these people, especially young folks, but what are folks who have pregnancy capacity or potential going to do come June, right? And what's going to happen the day after or the minute that these state laws go into effect? Well, let me tell you what they're doing to make sure that that's happening. And for those of us who are also providers of women's health care, I think a lot of us are still sleeping on this. So we know that while everybody's paying attention to Roe versus Wade explicitly, the movement that's going to play, because they're already expecting to win, right? The movement that is at play is how to formalize this in the healthcare settings, how to formalize a post-Roe world where they still control, intimidate, manipulate, lie, stigmatize, shame people out of abortion as a choice and into what we've been calling forced motherhood. And that's what so-called crisis pregnancy centers. Crisis pregnancy centers are being stood up as the next frontier of what will be the required or legislated go-to source for anyone who may be seeking an abortion, right? There are potential, there's like, I think 5 or 6 states that already have policies called the Every Mom or Every Mother Matters Act that are currently being put forth. And let me just give you a sense of what some of that language is going to look like. This particular measure is going to provide that doctors must confirm that a woman received a pre-abortion resource access. Pre-abortion resource access assistance offer in addition to the informed consent requirements in current law. This confirmation will occur when the abortion provider confirms the unique identifying number generated by a state Department of Health system for all pregnant people. Persons who are offering pre-abortion resource access assistance must be, and they give a long list of providers, counselors, doctors, psychologists, advanced practice, community health workers, nurses, physician's assistants, but then they say, or such a person could be supervised by those folks. So it could be anybody. And not only is this important to understand, but crisis pregnancy centers have been called in. And of course, if we remember the case Becerra, Nifla Becerra out of California, that the Supreme Court decided in favor of these crisis pregnancy centers or fake clinics being able to lie, to pretend that they are medical centers or providers of clinical care, that they now can just by law lie and tell untruths, but also misrepresent what they do and who they are. That's been bad enough for decades, right? That's been bad enough that they can provide false information. It's been bad enough that they can stigmatize and shame and manipulate people. It's been bad enough that they can actually just lie. But what's also insidious now is that they will be required places to go prior to an abortion. What is also insidious now is that they are tracking the behaviors. They're data mining all the personal and private health information that people are being required to provide when they show up at these facilities. They're using very sophisticated databases that will directly feed bigger, much larger anti-abortion machinery, as well as the far right electoral process. So if you've presented yourself at any of these crisis pregnancy centers, you not only have lost your protection of your own privacy in terms of your health information, because they're not medical clinics. So they're not licensed and they're not required to comply with HIPAA policies, for example. But not only that, but they can now take your information. And in some instances, they actually say that your information is private unless it serves our mission. Literally, that's the language that people would sign in an informed consent. So tracking your data is dangerous because that means for every person who actually seeks an abortion, especially in states that now have these SB 8 type laws like Texas has, they can actually use your data to directly report to anyone who wants to be in that vigilante mode and then create the criminalization or the civil, financial, and social and emotional and mental burden about being outed for your choice for abortion. Beyond that, which really scares the pants off of a lot of us who are in public health, is that they are also propping themselves up to provide HIV and STI services. They are testing people for chlamydia and gonorrhea predominantly. And there's a body of work that's been done by some folks right here in Georgia, at the University of Georgia, Andrea Schwarzenegger, Danielle Lambert, and others out of the School of Public Health at the UGA that have over the past couple of years been tracking data. They now have created a crisis pregnancy center map, because these places are also hard to find, right? it's hard to know where they are. So now we have a map to see where they are and what they're doing. And how about out of all of the 2,500 plus or minus crisis pregnancy centers, a 2/3, if not the majority of them, up to about 80% of them are actually providing these services with absolutely no access to referrals, no treatment, no follow-ups, nothing like that. But they will follow up with you if you chose to have an abortion, or if you didn't promise to not have an abortion, calling your home, calling parents, calling family members. These are some of the pieces that we are not going to be able to resolve just by protecting Roe in June. Even if nothing really damaging happens to Roe, these crisis pregnancy centers are already funded almost fully by the anti-abortion factions, but even more so by state governments. In my state alone, we have 89 crisis pregnancy centers, and there's a minimum of $2 million in a designated line item in our state budget that goes to them, as well as all of the funding that comes from the vanity plates, anti-abortion vanity plates that are also available to people who drive cars. So the issue of the problem, the privacy violations, the data mining, the dangers of identifying pregnant people who may have STIs and then receive no referrals or no services as a result of that, compound what Terry has already talked about. And like Terry, there are things that people can do, and what we're planning to do, like defund these centers. How are we making sure that we're electing the right people who will make sure that these dollars don't go into the state budgets? One of our partner organizations, or a group of our partner organizations like Spark Reproductive Justice Now and Amplify Georgia and Urge in Georgia, have routinely done things like review-a-thons, where we're literally going into the Googles and the Yelps and providing really, really honest and terrible reviews, being truthful. We also need to, in terms of the young people that we have, are serving up as secret shoppers to collect information on these centers as if they were clients. But we also need to be able to provide alternatives to the health services that they offer. They offer a lot of really powerful and important free care or free services and products to people who do become pregnant and choose to have their babies and or are early parents. Things like diapers and formula and all of the good coupons and things like that that people need. So where are we? For every, I believe, just like we're putting a mobile unit, we are putting a mobile health unit on the streets in June. And I think that wherever their units are, our units should be nearby. And okay, my unit's going to have speakers on it. I'm not kidding you. So that where we are, we can make sure that people understand the difference between going somewhere where they can lie to you versus coming to some place that's going to love on you and provide you the appropriate information and self-determination. We have to make sure that we're telling the stories. There are plenty of places like We Testify. There's the T Fund that's now collecting stories of experiences of people who've gone to these crisis pregnancy centers and have been traumatized or have been almost bankrupted by the fact that they've had to spend thousands of dollars outside to seek these services. And we also want to make sure that there's legal protections, legal support, and legal funding for people who are going to be persecuted by the fact that these folks are data mining them, tracking their information, and then making that information public. Crisis Pregnancy Center map.com, I think is I'm not trying to make sure. What I'll do is I'll put all of the resources that we have in terms of people who are collecting information on the crisis pregnancy centers and folks who are helping folks with how they tell their stories and how they counter the centers that are in their communities. This is the next frontier. And my fear is that we will be caught behind the 8 ball and not ready to respond when these additional laws go to effect alongside the trigger laws that Terry talked about. Thanks.
Daison, thank you. Cecile is someone who has certainly been trying to raise the alarm for decades and to try to help those of us who believe that abortion care is health care, and know all of the kind of data that Terry spoke about and understand all the dangers that both Terry and Dazan really kind of brought into painful relief. You, though, have never been one to kind of back down or pull the proverbial or actual covers over your head, and are always kind of in the business of trying to build, effective coalitions, and always in the business of trying to, not only raise the alarm, but try to mitigate harm and improve public health. So I wonder if you could, reflect on what you heard from Terry and Dazan, of course, but also share what you do think is working and kind of where you do see, the possibilities of trying to both mitigate harm and trying to help expand access for women and people broadly in this country for the care that everyone deserves.
Sure. Thanks, Chelsea. And it's always great to be with you and Terry and Dazan. I mean, this is a mighty crew. And just even having these conversations, I think to Terry's initial point, there's so much, people are so overwhelmed, I think, since we see every day there's another abortion ban or something being passed. And so I think even just having these conversations is helpful so that people can feel a little more prepared. I think pulling back, I appreciate this is being nested in this is a public health issue. It is a public health crisis, absolutely. And it is a public health crisis that has been completely artificially created for political purposes. I guess that's sort of my overwhelming piece. So maybe the piece I would add into this, in that, the irony of what we're dealing with here, and this isn't the only area of public policy or the threats to our democracy that this is true about, but this is an issue that is actually largely settled in this country. People in the country, in America, believe that the ability to make a decision about your pregnancy should be left to the pregnant person. They do not believe this is something that government should be doing. And depending on how you poll and what question you ask, this is upwards of 70%. So I guess my top line is this has been manufactured by one party in particular to create this crisis sheerly for political purposes of their own, for their own political goals. So I think a couple things I would just like to sort of also just put the groundwork out there. Abortion in the United States of America is incredibly safe. It's safer than getting your wisdom teeth out. This is one of the safest and actually very common medical procedure. And I think that part of all the hysteria around this has really lost that point. 1 in 4 women in America have had an abortion, at least. I'm one of them. They're everywhere. Everyone knows someone who's had an abortion. And so this is not some kind of rare, strange, dangerous procedure at all. And, as Terry mentioned, medication abortion, increasingly, there are all kinds of options, and we have to work hard to preserve all of those. There is an interesting report that relates not only to the health benefits and important, obviously before Roe, routinely young, healthy women were dying in emergency rooms across this country. So it has had enormous health benefits, but it's also had enormous economic benefits of people being able to finish school, people being able to have a career, people to choose when or whether to have families. There was an interesting Brookings report recently that really completely, outlined the difference it had made for, particularly when it was a study about women in America to have access to safe and legal abortion, the economic benefits, the career benefits, and particularly for Black women, that has been it reduced poverty and increased options for women to live whatever kind of life they wanted to live. I think it's really important to understand too that this issue, again, this is just my point of view, this issue is not about religion. This is not about morality. This is about control over women and their bodies. Now, there may be people who oppose abortion because of their own particular religious beliefs, but that's not what we're talking about here. We're not talking about how you feel about abortion. We're talking about, do you believe the government should be in charge of decisions about pregnancy. That is fundamentally what we were talking about. And I mean, as Dazan well knows, even when we get into areas of the Deep South, or even my home state of Texas, you know, people in Mississippi, we beat an abortion ban in Mississippi because fundamentally, regardless of people's personal feelings about abortion, they did not believe this is the decision that should be made by politicians and by the government. And I want to reiterate that because I think that's something we have to understand as we work to now, frankly, build on a right that we are poised to lose. There's been conversation. I mean, Terry kind of laid out all the horrible things that are happening, and I want to say a couple of things about that. But I guess the other thing to understand, and Dazan is really pointing to this in terms of this explosion of crisis pregnancy center, is we have not hit bottom yet. You know, in many ways, like we're not moving back to a pre-Roe world. We're moving back to a world that's even worse than pre-Roe, where we are now criminalizing not only medical providers, but anyone who assists anyone in getting access to abortion. And that is, I mean, as we've seen the bounty hunting in Texas, now Oklahoma, I think that, you know, unfortunately, one of the best examples is the recent example of the 26-year-old woman in South Texas who was basically indicted and put in jail with $500,000 bond over allegedly trying to terminate her own pregnancy. And not only was it horrifying for this young woman who was eventually released, because of course it had been an illegal incarceration, but under Texas law, she or anyone like her, anyone else, would be unable to ask for help from their mother, their sister, their friend, a teacher, a clergy person, anyone in her community. We are now essentially isolating people who are pregnant, who need help and need access to safe and legal abortion, and we are cutting them off from every person in their world. And I think this is something that it's on us to actually help people understand the horror that this means, because this is anyone's daughter, this is anyone's sister, this is anyone's granddaughter, grandchild. We have to help people understand what we are talking about in real human terms, to the point that this is not, you know, the end of the story. We're already seeing efforts, and I'm sure Texas will be right in front to limit or eliminate access to emergency contraception, which of course the right wing has alleged is an abortifacient. This is something now that has been widely available since the Obama administration, but we can see that next. And even though the message from a lot of the right wing is that this is a state issue now, that it's going to be state by state by state, I will tell you that if the Republican Party gains control of Congress this November, this will be HB1 in a newly seated Congress to eliminate access to abortion. This is not something that our opponents are going to rest on just because they are able to outlaw it in certain states. And I think that's the other political point I wanted to make, is that what we're seeing, it's not about simply making abortion illegal, because of course it's not about abortion at all. It's about politics and control. To feed the beast that they have created in states like Texas. That's why you see in Texas, it's not enough just to ban abortion. Then you have to start criminalizing people. You have to go after emergency contraception. You have to go after transgender children and their families. Because now that they have agitated this base in this country, they can't quit. They can't quit. And that is why I think we have to be aware. And again, as Dazan's points are really good ones, just aware that this is not we have not at all seen the end. The last thing I just wanted to, I guess, raise is that, and this is the work that Dazan has led for her entire lifetime, and that is understanding that this is about abortion is simply one piece of a much bigger picture. And of course, the states that we see criminalizing abortion, my home state of Texas, Mississippi, the case that's before the Supreme Court, are states where it's already pretty damn miserable to be a woman, or to be a woman of color, to be anyone that's with low income. So, but just to pick on Mississippi for a second, because I think it's a good example, since that is the state that's up, that has a case before the Supreme Court. The state of Mississippi argued before the Supreme Court that there was really no need for legal abortion anymore, because women have just done so well, that they've been so successful in entering the workforce and having economic security and stability that therefore we should just take this right away, and it won't matter. Mississippi is no great shakes. Mississippi is economically the poorest state in America. And maternal mortality in the state of Mississippi is twice the national average. A third of children in the state of Mississippi live in poverty. And we could go on. And Dazan, I'm sure you could write an entire book about this. But the same politicians who passed the abortion ban in Mississippi also voted down an effort to expand healthcare for new mothers in the state who are on Medicaid. Currently, so there was a proposal to give a year of healthcare coverage for the new moms that these legislators seem to completely, say that they care about. They voted it down, and today in Mississippi, you get 2 months of healthcare coverage after you've delivered. So the hypocrisy, I guess, of all of this, I think we have to continue to shine a light on that it's there. This is about forced pregnancy. And this is about forcing people to have children, and then the state completely abandoning any responsibility for their well-being. This is, and then I guess my last point here is, until there is a political consequence for people who have taken these actions, they are going to continue to go. And so I think it's important to understand what's happening at the Supreme Court, but this Supreme Court was seated by one group of people, and they are the ones who are responsible. And so I feel like in order to have accountability here, we have to point out that the states that are passing these laws are led by politicians whose entire goal has been to end safe and legal abortion. And that's where the accountability has to happen, not at this. Yes, we should understand the Supreme Court, but we've got to hold people accountable at the local level. Last thing, things you can do. One, support people who are supporting pregnant people right now who need access to abortions. So whether it's an abortion fund, whether it's a local provider, whether it's a reproductive justice group, these are groups that are overwhelmed right now. And as Dazan said, are going to be even more overwhelmed as each of these state laws begin to trickle into effect. So support them. Tell your own story if you can. We have to destigmatize abortion. This is a common procedure. It is something that should be legal and should be safe. And if you can, I think it's important to share your story so that other people don't feel so damn alone. Third, run for office. We've got to get rid of people that are in office, and we need more people who care about this issue to be the ones that are there. And fifth, for God's sake, go and vote. That's the only way we can actually, in addition to all the other movement building that needs to happen, ultimately, until people begin to pay a political price for what they have done to women and pregnant people in this country, they're just going to continue to do it.
Thank you, Cecile. I couldn't agree more with all of the actions that hopefully we all take and urge others to take. And I think too, we need not only women to be telling their stories, we need the politicians who also believe that abortion should be safe and legal in this country to take more of a leadership role in putting that on the agenda instead of just constantly responding to the efforts to criminalize a woman's right, a pregnant person's right to make what are the right choices for themselves and their families. And I do think we need to be having more conversations like this, because we all need, whether we've had an abortion or not, all need to be part of normalizing this this conversation and this choice that everyone should have access to. We have a few questions already submitted in the chat. Please, if you do have questions, please, I'll try to pay attention to both the Q&A tab and the chat tab. So please feel free to kind of submit them anywhere and everywhere. We had a couple questions, Daison, for you. So I thought maybe we could start there around the crisis pregnancy centers, wondering, one, do you think there are legal kind of remedies to try to help shut down the crisis pregnancy centers? Two, kind of what can people do to just try to raise awareness that these exist, and to kind of your point, or not providing, to be fair, sometimes, important kind of support to new moms, but are often providing care that is not kind of rooted in medicine or kind of best practices. So kind of just a couple of questions. One, around, are there legal remedies to try to help, make kind of this substandard care illegal? And two, what more can people do to try to just raise awareness that this movement is happening across the country too?
Sure. And of course, some of this I could defer to the lawyer among us. So Terry, if there's something you want to fill in for us. But first of all, I think the biggest legal remedy that would seemingly make the most sense is the one that the Supreme Court has already decided on. And that is to make it illegal for them to lie, make it illegal for them to deceive people. The deceptive practices in advertising is already written clearly into US law. And I don't understand why these folks get to be exempted from it, according to the Supreme Court. However, I think there are some other legal fronts upon which we are going to be able to come after them. One, in most states, for people who are pregnant, it is required that they be tested for HIV and for syphilis in their first and their third trimesters, and that they actually are referred into care if there is a positive result from any of those. That's a part of also the Public Health Services guidelines that all physicians, clinicians have to follow. If that is not followed, I think that there are opportunities for individuals as well as for other clinical providers to seek legal remedy against people who are creating more dangers and adding to the epidemiology, or the epidemics, if you will, of syphilis, especially congenital syphilis, for those who give birth and their babies are born with syphilis. That's one of the biggest ones. I think the second place where it's going to be even bigger is in the violation of their privacy. And the fact that someone could take your ultrasound and share that, the fact that someone could call your mother and talk about what happened when you showed up to a clinic, a fake clinic even, for services. I think these are huge grounds that can exist outside of an abortion argument, that speak directly to laws that are written into the Americans with Disabilities Act, that are written into the HIPAA policies, that are also written into informed consent policies and regulations across the board. What is going to be difficult is that a lot more of these clinics actually are increasing their medical providers. They are actually providing more clinical care service practitioners who still fit within the same rubric of being anti-choice and lying. So if you have an MD or a nurse practitioner who is sitting there telling you that abortions cause cancer, that they create psychological problems, that they create infertility, that they are more dangerous even than, root canals are actually higher risk than getting abortions. And so if you have a clinician that is going to profligate these kinds of lies, then those are also grounds for lawsuits. So I think that those are probably going to be the best protections. And if these Emma laws continue to gain traction across the states, like all these other copycat laws that they have to do, then there have to be folks involved in how that legislation is being written and how folks are being protected in terms of their privacy, as well as their right to correct and accurate, as well as supportive information. That I think are going to be the different ways to go at this time.
Terry, do you want to?
Yeah, I think, I heard a brilliant lawyer who's a specialist in HIPAA talking about a lot of the state protections are actually quite strong. So this issue of the source of the criminalization, they will not be able to prosecute in states, hopefully. But the fact that CPCs are not regulated, not under HIPAA is outrageous. And I guess one of my questions is to what extent the American Medical Association, all the lobbyists who fight for stronger HIPAA regulations because of financial reasons, in addition to privacy reasons, whether they are, eh, involved here, and we should think about that because it's absolutely ridiculous that these CPCs are not subject to HIPAA. Um, so I think there is going to be a lot, of course, the strength of the federal policies are dependent upon who's in office, right? So going back to Cecile's point about it all leads back to voting and who's in office, right? Because we can rely heavily on these federal protections, but they can go as we saw under Trump. So lots of questions.
I think, Terry, what you just raised for me too is that as there are more licensed clinical practitioners who are coming into these centers, that means they also have malpractice liabilities. And I
Yeah.
think that we should, and I think that if they are licensed providers, no matter where they provide the service, they absolutely have malpractice liabilities that we need to make them feel.
And, a set of questions really, I think, for all three of you. One, why are we not calling this a war against women? And kind of where is the outcry against, specific legislators in states, including Texas and others? Could we prioritize funding to support doctors to save the lives of their patients? And kind of, again, a few questions around, how do we build a coalition against a party that is just so dishonest? So I think, a question about kind of why is this not called a war against women? Why is there not more outrage? How do we try to build an effective coalition? And then maybe we can come back to the specific question about how to get more funds to doctors who are, and providers broadly who are providing abortions. So I don't know, Terry, you're unmuted, so maybe you can go first, and then
Oh,
Faison
yeah,
and
I have to
Cecile.
mute myself. I'm kidding. So I think, I think there's a lot of stuff going on. One is that I think we missed an opportunity for many decades to actually talk about all those children who are dying in foster care as a racial justice issue, linking, the maternal mortality rates to horrible outcomes from maternal child health in the states leading the fight to restrict access to and restrict bodily autonomy. So I think, the mere fact that Amy Coney Barrett could talk about safe havens as basically taking away the bodily autonomy intrusion. They just carry the term, they take the babies to safe haven, we terminate their parental rights. The just incredible lying that's going on in these discussions about what is actually happening to children, to women, particularly to children of color. I think we have to, as Cecile was kind of outlining and Daison always does, we have got to bring these other parts of the discussion into the equation. That's what I saw work in Ireland, linking maternal mortality to bodily autonomy, to abortion, linking, the Magdalene laundries to these type of policies. So I think that's one thing. I also think people just at some level, people who support the right to abortion just cannot believe what's happening, right? If they have that privilege to not believe, if they're in an access state, and I guess that's why it's so important to have this conversation. It is happening. And I can't answer why we're not screaming about the war on women. I mean, we certainly are. So that's kind of a partial answer.
Yeah. I mean, I think everything you've said, Terry, is spot on. And I think that Loretta Ross, professor at Smith College, also one of the creators of the theory and the terminology around reproductive justice. She talks about how there's we need so many more on ramps to understanding the intersections and how interconnected and interdependent so many of these issues are. And for us, we still operate in so many silos that we tend to not identify and then build our movement around these on ramps. And so I personally call it's actually a war against democracy. And Cecile has laid that out so effectively. I think it's a war against democracy within which women and girls, Black and brown bodies, trans, gender nonconforming, gender expansive bodies, incarcerated bodies, bodies that are on the move like migrants and immigrants, that all of this, undoing people's ability to assert their own political rights, their First and Second Amendment, First and Fourth Amendments, that these issues are about shifting our country away from its original design into what its original practice actually was, which was a country that was built for, or built in the interest of, because it was built by other people, but built in the interest of white, heterosexual, heteronormative, cisgender men. And so every aspect of these things that are interconnected is about that. And the way to get to that is to undo democracy. And a part of the way that you undo democracy is you start undoing individual rights. And that's exactly where we are right now. Yes, it's a war against women, but it's really a war against human rights. It's a war against dignity. It's a war against autonomy. And quite frankly, it's a war against people's rights to exist. And so that, I think, is where we really need to take this fight, because the fight is bigger than just about women. However, if you don't win the fight for women, you don't win the fight for the rest of them.
Amen.
I think that's right, Dazan, too, because we are the tip of the spear here. It's like, they're coming for everybody. And I think this is the first, well, you could say voting rights, absolutely, and all the assault on voting rights, because taking away people's ability to elect their own government is obviously a move to authoritarianism. And we're seeing that not incidentally in the exact same states, but I love Loretta's formulation of we need a lot of on-ramps, because I also, to kind of call ourselves out a little bit, I think it's, we talk in terms oftentimes that are not the ways that normal people live their lives and kind of understand what's going on. And so I think we also have to check our own selves, because it's, I know it's interesting. We're thinking about these issues all the time. We just did a poll with a group I'm with, that women after 4 years of Donald Trump, half of them say they're not paying attention to politics as much anymore, because that was they were paying attention because it was a matter of survival, and they're exhausted, and then COVID. And so I think we have to also provide as many ways for people to understand and be able to take action that are simpler than I think we have perhaps provided. This whole theme of loss of freedom is something that is actually felt pervasively, particularly by women in this country. And so I agree, Dazan, completely on that. They're not going to use the same words. And I don't think we talk about these have been constitutional rights as much anymore. I don't think that's actually how women live their lives, or people live their lives. But not to be able to make a decision about a pregnancy is about as fundamental as you get. So I agree with you. It is a war on women. It's a war on everybody. But I think sometimes the war on women is a formulation that helps some people put it in perspective. Because I think one of the things we're seeing is people are going, what happened? Mm-hmm. Like, what? Who's behind all this? And we haven't done a good job of explaining that actually this is a political fight. These are not people who are caring about babies or caring about the unborn or caring about mothers No, man, this is a political fight. And I just feel like we have been reluctant sometimes to go there. And then the last thing is, because someone asked a question about when are men going to be held accountable. Okay, well, we can we could dine out on that for a while. Who knows? But I do think generationally, there is a change and there is an opportunity to engage men in this fight. And it is not going to be won by women alone, or by people who are progressive alone. So I think there's also, and I will admit, I've never was really focused on bringing men into a movement at Planned Parenthood or really focusing on them, but we're going to need them too. And so I do think that this is a time to think about how are we offering up the chance to take action and fight back for everybody, because it's not only people in red states, it's people in blue states, it's people from all walks of life, because this is a universal problem.
Thank you. Terry, we've gotten a couple questions around the abortion pill. And I know you spoke about that, in your opening remarks. And I wonder if you can just kind of speak a little bit more around kind of what are the real access barriers for people who would want to access medical abortion, when kind of the FDA finally lifted the restrictions late last year on kind of whether or not, you could kind of receive the abortion pill by mail. I think a lot of people did think, oh, well, now that's just going to be an option for everyone. And yet, as you kind of were nodding toward earlier, that isn't the reality for many people today, and could become even less of a reality for more people in the near term. So could you just talk a little bit more about that? I think people want to know. Thank you.
Yeah, I mean, I think this is an area where the federal regulations, the FDA has done a good thing, right? So there is going to be litigation about whose jurisdiction, if the states start trying to prosecute, women who are, or pregnant people who are taking the pills, there's going to be a battle about what applies. I was in a room with some very smart people who couldn't predict how that will turn out. Obviously, the FDA is also a political entity, right? So also connects to who's getting elected and who's in the White House. So just keep making those connections. I think that the right wing realizes that this is game over if we do the work that people have appropriate access to abortion medication, and do the work is a big process given the context that we've described here. So they are devoting enormous amounts of energy to figure out what's going to be the most effective way to block access. The access that activists on the ground are scrambling to create and widen, and they're playing as they do to people's fears, right? This is they're stirring up all these arguments about safety, et cetera, which the FDA clearly vetted. So very hard to predict how this is going to play out, in all honesty. And it's extremely worrying. And also, again, we make progress, and all of us who work on these issues are now stuck fighting these absurd kind of attacks. I have to say, having just sat in a meeting with people who have to figure out how to prosecute these cases, I mean, the mind-boggling nature of being in a state where there's no longer an exception for incest and rape, and you're a prosecutor and you see many adolescent girls, not only girls, who are pregnant and will likely not survive an abortion, will likely not survive a pregnancy. It would be safer to have an abortion. These are the talking points that drive the global campaign against child marriage, right? And here we are in the US, and this is what we're looking at. And so, there's so many levels of questions around medical abortion, and what's going to stand up in court because there will be every attempt to try to, try to make it illegal.
Thank you, Terry. A question, which I'm just going to read to ensure that I get it accurately kind of into the conversation. I'm very interested in the human rights angles here and the context of direct action and activism. Wondering if you can speak again to the connection between the political fight and the dire need for deeper direct action and resistance. Of course, in a very hard climate and in contexts of exhaustion. And I wonder, Dezan, if you could maybe start, because you have a lot of experience in working across kind of the direct action and political fight frontiers.
Sure. So, and thanks for the question. Hey, Cynthia. I think it's important for folks to understand that for me, there's maybe 3 levels, but there's 2 core levels or core positions in terms of where we enter into this conversation when we're engaging it from a human rights perspective. And that is that in the regular world of things, human rights actually should be in the legal space. It really should be in a place where rights are protected, where there are ways that rights are critically defined, not only at the state, meaning the federal level, but also at our local, provincial, state levels, to match up to what the aspirations of the Universal Declaration of Human Rights are, right? Or even the covenants that the United States, many of treaties of which have never ratified or agreed to. So there's that legal realm of where human rights needs to exist. But human rights really are about dignity, really are about justice, really are about equity. And so wherever we're identifying that people are being treated without dignity, or that's being stripped away, where their equity isn't being protected or emphasized, then that's where our fight has to go. That's where the practice has to go. And I think that as someone who comes out of the ACT UP world, as much as we come out of the fight for abolition, for example, or as much as we have seen the activism in Black Lives Matter, Black Voters Matter, whichever way people have been asserting these specific rights that we're supposed to be protected about, it's time for us to acknowledge this in the same way when we're talking about access to abortion, when we're talking about contraception, and I know there's a next question around comprehensive sexual health education, that we have to take more of a how does this impact our community approach. The individual aspects, the individual right to abortion, the individual right to choose is one component of a human rights paradigm. But within that framework, there's also the element of what this means for groups, right? So what does this mean for communities? What does this mean for people? What does this mean for a people? And I don't think we do that as much. We're not identifying what we're doing as a practice in our work, in our workspaces, in our community spaces, in our faith spaces, in any of those places. I give an example of the Black Reproductive Justice Policy Agenda that was released back in September, which is making its way through. I don't know if the science has been connected to it or if the data has been connected to it, but I think it's interesting that the Black Reproductive Justice Policy Agenda came in at the same time that we had for the first time, and I don't know how, at least since the beginning of the Hyde Amendment, had a budget come out of the House without the Hyde Amendment attached to it. So that meant that some of these intersections are starting to seep through. And in the Black RJ policy agenda, there are 3 sections that are relevant to this part of the conversation around the human rights framework. We're not only focusing on sexual and reproductive health policy in that agenda, but we're focusing on social justice, on community justice, on human rights and safety in this policy agenda. And we're focused on religion and reproductive justice in this policy agenda. And that's because the other thing about our using a human rights framework means that culture plays an important part. So how we believe, how we talk about how we believe, what language we use, and how we even determine what kinds of services we want, when and where are also important. The last thing I think is really important is that a lot of this activism requires us to be counter to the current laws that are unjust, right? So civil disobedience is going to be even more critical. And we have to pay attention to what Terry talked about in terms of criminalization, because we have to watch who will be most criminalized and punished or penalized for that activism. But in addition to that kind of activism, we also have to recognize that resetting the resetting the social acceptability, the social custom, the social pariah of being a hypocrite, of being able to control other people's bodies. We have to shift that frame that is not okay, because that is not a part of the human rights framework. And so if we want to think and believe that abortion is not only a right, but that it is a human right, because it is my right to determine what dignifies me, and the equitable access to those services and programs that uphold what I believe dignifies me. And so that's where I think it is. And I don't put it past us to need to have, and I put this in the public space, that the need to have an above or a public facing strategy, as well as an underground, in some instances, extra legal strategy, to make sure that no matter what happens, that women and girls, people who could be pregnant, will continue to get the resources and the services that they need in safe, affordable, accessible, and indignant ways. That's really a core of what I think a human rights approach to all of this is going to have to be, especially if we're going to be activists about it.
Completely agree. Thank you, Dazan. Want to be mindful that we do have more questions. So Dazan gave a nod to the next question, which was around implementing more upstream efforts and better access to sex education, in which I would like to humbly submit some of what you all have already said today should be included in that. Like, what is an abortion? And it is safer than having your wisdom teeth pulled. And yet we know that simultaneous to everything else we've discussed today, there have been efforts to roll back sex education in our country. There are many states, actually. I mean, I went to public school in Arkansas in the 80s and the early 90s, and I had age-appropriate sexual and reproductive health education. I mean, some of it was really awkward, actually, to sit through, because it was important. And if you are a public school kid in Arkansas today, your sexual and reproductive health education is not as good as it was 30 years ago. I mean, what a damning thing to be able to say. So I think this is a really important question, public health, human rights, kind of, medically informed, age appropriate sex education. So I wonder, Cecile, I know you've thought a lot about this and worked a lot. You could go first and then, yeah.
I mean, it's just the irony of this. The first nonprofit I started in Texas was to end book banning. And now it's become, because of course the same states that are banning everything else are banning sex education. They're banning anything that talks about anything. Again, it's this whole theme, I think, to Dazan's point, it's this whole theme of freedom and autonomy versus authoritarianism. We don't have to use those terms, but we can use the examples to say, if you feel less free, it's not you. It's actually, it's happening. So look, I just think sex education and the banning of information for people is just part and parcel of the bigger, the bigger macro topic that we're trying to elevate here. The only thing I wanted to say, because I know we're also running out of time, is I just want to make sure I was on Dazan's team. I do not believe we are going to win this battle by voting alone. That is a tool in our toolbox that we have to use, and it is something we can use to fight back. But we have got to be in the streets. We've got to be getting arrested. We have to be doing that term? I love that, extra legal tactics, because if people do not believe that or understand our anger, we will just continue to lose and lose and lose. And I think there are great examples in our history, and even current day, whether it was, Ireland is a good example. Look at South America as a good example. There are countries that are making change in the right kind of way. And it wasn't simply by waiting for elections, because it's the way not only are we going to get the Republican Party to sit up and take notice, but just to be honest, the Democratic Party as well, because we are not doing the work in this country to stand up and lean into this issue of rights and human rights. And we need everybody to be on notice on that. So.
Yes, I mean, I couldn't agree more. I was thinking, I spoke at a couple of the Rise Up for Roe events in 2018, which, all of us, who are at least illuminated on the screen, we've talked about this before. And the amount of hate that I received because I made some of the similar points that actually abortion is an economic issue. And we can see when women had access to contraception and abortion, like we actually went to work more and stayed in work that hopefully gave us dignity and purpose and meaning and contributed a couple $1 trillion to the American GDP. And it was as if, I had said that the worst possible thing anyone could think of. And so the reason not to have a narcissistic moment, we also have to support each other because the right is vicious and hateful and do not care about any of the words that Dazan or Cecile just shared about the importance of dignity and human right and recognizing this is, yes, an individual rights issue and a community issue. And it will only get worse because, as Cecile said, the hate and the cruelty are addictive.
Mm-hmm.
And the mainlining of hate has to become more and more potent to keep the base engaged and enraged. And so this will not be easy, but hopefully it will be easier if we all just continue to support and uplift each other and find more on-ramps to bring more people into this conversation because we need everyone. I'm mindful of time. There were a few more questions, one about kind of the intersection of the attacks on reproductive justice and neoliberal economic policies, one on kind of whether or not kind of what is being considered in Connecticut to protect providers and patients when folks do cross state lines. Kind of should that be a model for other states to consider? I want to be conscious of the earlier question that was asked about how to kind of get more resources into the hands of providers. So in our vanishing time together, maybe we can start with Terry, and then go to Cecile and give Dazan the last word. If you want to reflect or answer any of those questions or kind of just to share final thoughts.
So I guess there is a lot of work going on in access states, the Connecticut now bill being kind of a model, I suppose, but there are many efforts and counties getting ready for the influx. There's not enough money, there's not enough, and so people should really give to those efforts. And what access states do and how proactive they are is absolutely critical. I do want to say that, this is absolutely an intersectional human rights issue. People and women and girls, women and girls are really going to be harmed. That's what we are looking at. From a public health perspective, they're really going to be harmed. And I do want to just remind everybody that by the very same people who fight the things that would prevent unintended pregnancy, right? If you look at who's pregnant and doesn't want to be, it's lack of sexuality education. There's links to, frankly, violence and abuse and power. So think of all the ways that these very same people just prevent progress on addressing any of those issues. So we are in the dystopian moment where people are really going to be hurt, which is why I think I say to the people who are just overwhelmed and exhausted, there is joy in resistance, actually. Our students are organizing. They're going to do a civil disobedience. They projected onto the Loeb libraries an pro-abortion message. So I think your point about how we treat each other and how we understand dignity also, we need to also kind of support each other and see the joy in resisting what is essentially hateful, misogynistic, homophobic. I mean, use every intersectional hatred is what we're fighting. So I just want to urge everybody to please do something, whatever you're comfortable with in the list that has been provided. Please do, and use your voice in this moment. It's critical.
Cecile?
Yeah, I mean, just amen. I just say like, do more. That's the most important thing. Do more than you're doing and do something that scares you. Because this is the time where like we can't be waiting for instructions or waiting for permission or any of that. And I really appreciate this. And I want to thank all of you all for being part of this. It's a joy to do this work with you.
Son, it feels appropriate you would have the last word.
Thank you. I appreciate that. I think I concur, of course, with Terry and Cecile. We're usually on the same page on almost everything. And there's a couple of things though. First of all, just on that comprehensive sexual health education question, sex and sexuality question, I just want to come in and say, I grew up in a household that was a reproductive health. I grew up in a household of educators who were also biologists. So it was normalized in my house from the time I was a little child, a toddler to, that's the thing though, is that I don't trust our public schools. I don't trust our school systems. I don't trust putting sex and sexual health education in the hands of public space or political decision makers. And I also know that generations of communities did not get sexual health education, and that can be in and of itself a deterrent and a barrier for young people who are getting sexual health education, living in houses with people who never did, or going to churches or working in communities with people who never did. I truly think we need to back up, start over, and reframe sexual health education as a community education effort, similar to other things that we communicate general populations about. But having said that, I'm going to quote Loretta one more time, as Terry was talking about finding our joy. And Loretta talks about how fighting hate should be fun. It shouldn't be burdensome. It shouldn't be something that wears us down. It shouldn't be something that we internalize and depress. It should actually be something that we are joyful about, that we get excited about. And I will end on, in terms of action and Cecile's call to action to do more. There's a question also where someone's asking about, will there be another Women's March in DC? I think there needs to be a People's March in every state, because that's where all these decisions are happening. So instead of 200,000, 300,000, a million, 1.5 million people flocking to DC to impact Congress, that's one thing. But how about getting 500,000 to 1 million people to come to Atlanta, Georgia, or to Jackson, Mississippi, or to Austin, Texas, or to come to those state houses where these decisions are impacting people in the state, and see what happens. And so that is the thing that I would close on, is that we not only have to think differently about how we do this fight, but we're going to have to show up differently about how we do this fight. And in many ways, make sure they don't see us coming, but they do see us once we're there.
Thank you all so much for your time and your wisdom, and for sharing your joy, and for calling us all to do more, because there is just so much to do. And yet we know what we need to do, partly because of these three remarkable leaders today. So thank you to everyone who joined us. There was a question about whether or not there will be a recording. I suspect that there will be. Terry is nodding in the affirmative. So yes, please share this conversation, and share the action list so that we all can do more. Thank you all so much.
Thank you, Chelsea.
Take care.